نعمل علما لما علمتنا زدنا علما عملا يا أرحم الراحمين. I'm Dr. Mohammed Al-Maghrabi. I'm going to give you this very quick, actually. It's two compressed lectures together. We won't talk a long time, inshallah, maybe 1 hour and some minutes to finish both two lectures together. This is the first time I'm giving this module. I'm giving virology and bacteriology for medical students. I used to give, but a long time ago, maybe before 6 years or something like that. I give 334, and this one 535 for dentists or dental college students. Today, inshallah, we are going to cover oral viral infections. And then, if I take you back to the introduction in virology, we can classify viruses according to their genetic material into DNA viruses and RNA viruses. And in DNA viruses, we have single strand and double strand. Also, in RNA virus, we have single strand and double strand. In RNA, we have a single strand positive sense and single strand RNA negative sense. Anyway, I wouldn't like actually to go back to the introduction and to the basics of virology. You have to cover that already. So now we are going to go, specifically in oral viral infection. And now I will, as you know, type of oral infection: viral, bacterial, fungal infection. But now we are emphasizing only viral infection. Type of lesions, as you see here in this picture: vesicles, ulcer, and benign malignant trauma. Actually, we are describing only outline sketch on oral viral infection. This PowerPoint presentation is teaching material only. It is not complete study material. The students are advised to follow principle and practice of clinical virology, 6 editions edited by Air Jackson, Zuckman, and his ATL. Okay, local viral, oral viral infection. There are some viruses which can cause viral infection, oral viral infection. We have human herpes viruses, and there are different type of human herpes viruses. We have herpes simplex virus 1 and 2, varicella zoster virus, Epstein-Barr virus, cytomegalovirus, roselovirus, and oral carpoxysarcoma neoplasms. If you look at this picture, you will see a different manifestations of oral infection. We have gingivitis and pharyngeal tonsillitis. As you see here, these lesions are quite often seen in clinic, which show you the oral or viral oral viral infection. Now we are going to take the first virus, which is human herpes virus 1 clinical manifestation. Symptomatic primary infection, which multiple small clustered vesicles in numerous locations can occur anywhere in the oral cavity, on the peripheral skin, on the pharynx, or in the genitalia. Uh, Herpes simplex. There are two forms: herpes simplex 1 and herpes simplex 2. One, uh, if anyone infected with herpes virus 1, this kind of lesions, as I showed you before, can be observed on oral area of the patient. Primary hepatic gingivitis often affect children or young adults, and kissing one of most important transmission routes of these viruses. The initial clinical presentation can be severe with physicals throughout the oropharynx, oropharynx, and perioral skin, in contrast to the much more limited presentation typical of recurrent herpes. This is the problem. Recurrent herpes, because herpes, it's not only it doesn't comes alive once. Sometimes recurrent. It comes and goes. It comes and goes. It comes and goes. Wherever the people share the virus, the infection can take place. So recurrence is most often noted clinically as herpes labialis, with clustered vesicles on the lip, vermilion, and often to the peripheral skin. Um, we are going to cover how can we prevent infection to take place. But generally speaking, what I need you to know that this virus can appease many times because it recurrently exists. Okay, here you see in this picture herpes labialis, appear lips and lower lip. Sorry, an upper lip and lower lip. You see this one, and if you see in your clinic someone comes with this manifestation, with this, I mean, vesicles and this ulcers, it comes to your mind. This patient might has a herpes virus. Clinical history of um, human herpes virus 2. This is the second form and second type of herpes simplex virus. Um, we call it herpes simplex virus 2 or genital herpes virus. So, there in the first one, the most route of transmission is kissing, touching. I mean, um, it's not like the second one. This one is transmitted mainly through sexual um, transmission route. Um, it's less common. Its oral manifestation are clinically as same as herpes simplex virus 1. How can we differentiate between? How can we investigate that? We have to send sample to laboratory, and in laboratory they will tell you which type of virus is that, because it's not easy. If you see the lesions around lips, upper or lower lips, um, it doesn't mean that. But one more thing very important to differentiate between herpes simplex 1 and 2: if there is any rash regions on genital area, this is herpes simplex 2. If anyone comes with lesions around lip, wherever lower or upper, without any manifestations on genital area, most likely this is herpes simplex 1. If there is any rash around genital area, that means it is herpes simplex 2. Okay, activation of herpes simplex 2 after herpes simplex 2 seen more common in HIV positive males. Clinical history for human herpes virus 3. This is in next slide. We call it varicella zoster and chickenpox and shingles. You know, chickenpox, I think most of you, at least, um, I mean, considerable number of people from you have got chickenpox, which is Samil Angas in Arabic. First exposure results in itchy vesicles of the skins. If you, one of your family member has got chickenpox, um, he can tell you, oh, you can tell other people if you have got the infection already. You will observe itchy vesicles on the skin, on the trunk, and spread to the skin of the head. Anterior and pharyngeal vesicles may occur. Recurrent varicella or herpes zoster or shingles usually occurs in adults. It results in vesical rash and inside the oral cavity. This may be observed as a vesicle or ulceration that stop sharply at the midline. Um, a prodrome of pain, burning, or itching that mimics a toothache may occur after resolution of the rash. Post herpetic neuralgia may, I mean, linear for the mouth or longer, especially in patients who are immunosuppressed or those older than 50 years. That mean if anyone over 50 years, their immunity will be in somehow impaired, not like youth and young people. Usual complication or complications can include devascularization of teeth, root, devascularization of teeth, root, and um, resorption, sorry, and root resorption. There is a syndrome, we call it Ramsay Hunt syndrome, arise when the virus emerge from latency. Latency that mean it is a form of recurrent infection. Latency that mean when the virus exists in the body without any symptoms, and under some circumstances, this virus cause infection or recurrent infection again. The period where the virus enters the body until the virus initiates symptoms, this is we call it latency in the I mean uh, geniculate ganglion. It is involves cranial nerve 2, which is facial nerve, which has both motor and sensory function. Manifestation may include paralysis that involve the levator palatal muscles and the face. The problem, the problem, one once this virus gets to that area, it can cause, as we said, paralysis and lose of secretory function. Um, and also, it can affect pharynx, the external ear, and traumatic membrane, tympanic membrane, tympanic membrane, which also one form of manifestation. Presenting facial nerve weakness or deafness sometimes may follow the infection. Um, this is hairy leukoplakia. This is in tongue. Infectious mononucleosis, you see here, and Burkitt's lymphoma. This is very bad, three and form very bad form of varicella zoster. This is one of complications. It might occur after varicella uh, zoster infection as a complication. Clinical history of herpes simplex virus, for which is Epstein-Barr viruses and causative of infectious um, mononucleosis linked to African Burkitt's lymphoma. This, what we see it now, this is Burkitt's lymphoma, Epstein-Barr viruses. Primary infection at young adulthood is often subclinical infection. The virus usually acquired from infected saliva. Um, by the way, not most, all of body secretion, like saliva, which when saliva remain in salivary glands, um, urine, blood, tears, all these body fluid are sterile. CSF, cerebrospinal fluid, all these fluids are sterile. Once there is infection, the virus or the bacteria exist in this body fluid. Bear it in your money, in your mind. Bear it in your mind. All body fluid are sterile and they have 0% of pathogens. The virus, as I told you, replicates in the cells of mucosa and salivary gland and spread to P lymphocytes and to bloodstream. Once the virus get to the bloodstream, it will cause what we call it. It will cause um, viremia. Once viremia initiated and the virus exists in bloodstream, it can attack a different organ and a different system of the body. طيب. Um, if the patient is immunocompetent, that mean the immune system is really good working, and in competent, that mean it's adequate enough to fight against viruses and all type of pathogens. Cytotoxic T cells become activated and characteristic lymphadenopathy accompanies tonsillitis and hepatosplenomegaly. Tonsillitis may be severe and may enlarge the airway. Thrombocytopenia may complicate the infection, make the infection more complicated, and petechiae may be noted on the junction of the hard and soft platelet. Uh, plate. The patient may report headache, fever, malaise, myalgia, and fatigue. Severe abdominal pain may indicate a splenic rupture. Okay, now we taking one manifestation, which is hairy leukoplakia, primarily seen in adults who are immunosuppressed. Immunosuppressed, that mean their immune system is not adequate enough to fight against pathogens. Hairy leukoplakia uh, manifests is a symptomatic white lesion on the lateral border of the tongue, often bilaterally. The lesions may be observed on the adjacent disorder ventral surface of the tongue. Occasionally, lesions are present in other sites, such as the buccal mucosa, and need to the um, commensurs. commensurs. طيب, this is already covered. Move to this. This is carbosarcoma, and this is gingival atrophy restriction. This one. Don't forget this. This is carboxysarcoma, and this is because of Epstein-Barr virus. لا اله الا الله. طيب, clinical history of herpes simplex, sorry, human herpes virus 8 is also known as KS associated herpes virus. DNA sequence identified in Kaposi sarcoma. This virus, in the oral cavity, follows the same disease pattern of in other body sites. Lesions may be red, purple, or dusky patch that enlarge into the plaque and later progress into tumors mass. It is observed most frequently in immunosuppressed patients and rarely occur in children. And this is one bounty of Allah subhanahu wa ta'ala, because it's only observed in immunosuppressed. Um, Even this suppression is um, deliberately made, like when we give medication to those people who are already has got organ transplantation, like kidney transplantation, or like HIV and all these people with low grade of immune system. In the oral cavity, early KS, or human herpes virus 8, mimic an uh, what they call it, tattoo. Tattoo. Some people, they got tattoo, and because of that, they might get the infection. The palates in the initial site of intraoral oral KS is approximately half of cases. Other favored sites include the gingiva, the tongue, and the tonsillar area. You see here, 1 and 2 show herbangenia, and 3 and 4 hand, foot, mouth disease. This is are going to be covered in the next slide, which is Coxsackie virus cause these two manifestation. We are going to cover that shortly. Hand, foot, and mouth disease, or herbangenia, acute levonodular pharyngitis, are caused by Coxsackie virus, which is our we are going to cover the manifestation of this virus uh, shortly. Oral symptoms: mild pharyngitis, erythema of the oral mucosa occur with hand, foot, and mouth disease. Herbingenia and acute lymphonodular pharyngitis. Extract rash occur in hand, foot, and mouth. You see here, hand, rash, and mouth rash. This is because of Coxsackie virus. Clinical history: um, incubation period 3 to 6 days. Mild fever with myalgia, anorexia, and sore mouth. Oral physical, vascular sorry lesions seen after 1 to 2 days. Skin lesions follow oral lesions is approximately 70% of children. In adults, only 10% shows a cutaneous rash. The infection usually lasts from 5 to 8 days. Oral lesions generally occur in group of 5 to 10 vesicles that soon rupture and often uh, coalesce, resulting in uh, um, shallow ulceration surrounded by erythematous halo. This is the picture which can show you. Sometimes it comes like one and then they emerge together to cause these lesions. Okay. It can appear on buccal mucosa, tongue, and soft palate. Combined skin lesions occur on the distal and lateral aspects of the hand and feet, and on the finger and toes. Skin lesions are approximately 3 to 4 to 7 millimeter in diameter and consist of a mixture of papules and clear vesicles of surrounding zone erythema. Herbingenia. Herbingenia at the sudden onset of infection results in fever, sore throat, and painful swelling or swallowing of many hours. Appearance of physical lesion on the posterior aspects of the pharynx. Other symptoms include headache, anorexia, vomiting, and abdominal pain. And this is the first virus can cause abdominal pain because of the infection. The fever usually, subsides in 2 to 4 days, but ulcer may be present for as long as 1 week. Most cases of herpingenia are mild and resolve spontaneously. That means it's self-limiting disease or infection. Self-limiting. It goes from itself. It doesn't need any medication, but sometimes it needs. Okay, the oral lesions begins as punctate and muscles that evolve other 12 24 hours period into 2 to 4 millimeter erythematous papillus. Physical change and central ulceration follow with development of peripheral zone of erythema. The lesions usually occur in group of 2 to 6 and um, moderately painful. They occur on the soft palate, usually between the tonsil and the alveolar, uvula. The lesions are less frequently observed on the tonsil, on the posterior aspect of pharyngeal wall, or in the apicomucosa. Okay, now we are going to cover The third form of manifestation caused by Coxsackie virus. So now we go to acute lymphonodular pharyngitis. It is considered a variant of Herbangenia. The pattern is distribution of oral lesions is similar to that observed in Herbangenia. The main difference is that occur lymphonodular pharyngitis, the pharyngeal lesions remain papular without progression in vesicles or and ulcers. So there is no, it's only lesions, no vesicles, no ulcers. If you see here, this picture will show you a different form um, of infection and manifestation. You know, this one, this form, and this form. So papilloma, this one, and this one is we call it Friuca. So this is condyloma of tongue and condyloma of gingiva. This is this picture. It's an introduction to human papilloma virus. Uh, Furica vulgaris or common warts are more common on the skin than the oral cavity. On the oral mucosa, the warts are usually, I mean, usually sensitive. It's white, solitary, and multiple, and elevated with discrete borders. The lesion most commonly occur on lips, hard palate, and gingiva. Gingiva, gingiva. Sorry. Verica plana is similar but less uh, elevated. Uh, this manifestation, which is condyloma, acuminator, or what we call it, genital warts, occasionally a human papillomavirus. This is different strains affect the oral mucosa with as well as genitals and peripheral regions, larynx, or trachea. These lesions are usually, I mean, cerebriforms, pink, and sessile, and solitary or multiple. They occur more commonly on non-keratinized mucosa than the keratinized mucosa. Patient infected with human papillomavirus 6 or human papilloma virus 11 and their sexual patterns may have genital lesions and the lesion have presumably been spread on the oral cavity via oral genital tract contact. If there is oral genital contact, the human papillomavirus can observe in oral cavity. Um, Focal epithelial herpesplasia or Heck disease. This is may appear as an epidemic in young adults in small countries. The condition was first described in native Northern American people the first time they've seen Heck disease. Heck disease typically manifests as multiple smooth and sessile nodules, often on the mucosal surface of the lower lip or on the apical mucosa. Lesions may regress spontaneously after a number of months. Other type of infection, we have mumps, mumps, measles, mumps, and um, rubella. Mumps is lower grade fever, myalgia, lack of appetite, and headache. This is manifestation. After a day, um, I mean, tenderness, period glands, parotid gland observed. The enlargement of this is it quite often in your clinic. You will see maybe this virus, mumps, nukaf. Mumps, um, it's the infection of parotid gland and it causes parotitis. But this type of viruses, it causes an enlargement in parotid gland. Um, this is quite often in your clinic. You will see you will see definitely some of this manifestation. The enlargement of parotid gland is unilateral, or sometimes bilateral, with salivary gland because this virus targets salivary gland and it causes enlargement of this um, gland. So, as a consequence, the enlargement of parotid gland is observed. Once maximum parotid gland swelling has occurred, the pain, fever, and tenderness quickly diminish. The affected parotid gland return to its normal size within 1 week. Complication, because this also another self-limiting uh, infection. It goes with itself, but sometimes we have to give medication for symptoms combined with this virus, not because of the virus infection itself. Complications of parotitis is uncommon, recurrent, acute, and chronic. Citizens uh, are potential complication of parotitis. Another one of another one of viral infection, measles. The incubation period is approximately 10 to 14 days. It is longer in adults than in children. Fever, malaise, anorexia, conjunctivitis, and respiratory symptoms are common toward to the end of the prodrome and just prior to the appearance of the rash. Complex spots are observed on skin. Eruption of measles lasts approximately for 5 to 6 days, and also it can be observed in oral cavity. Measles also can be observed on oral cavity. Rubella, I mean, interorally, and erythema consisting of petechial lesions known as the we call it Forkenheimer sign is observed on approximately 20% of patients. Clinically, these dark red uh, papules are observed on the soft plate. These lesions may arise at the onset of rash. Petechia are also occasionally observed. Uh, the Fokker-Hemmer sign is not pathognomonic of Rubella infection. Is not pathognomonic of Rubella infection. I think this is all about our lecture today. There are some cases which can actually show you how could you see the 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 infection like this one. 23rd-year male with uncompromised host history showed internal oral lesions. Culture and histopathology were undertaken for ulcerative lesions of the lapel mucosa. The culture were positive for herpes simplex 1, while the histopathology revealed cytomegalovirus virus infection. What's interference of the report? You will see here a case of recurrent oral herpes simplex virus and cytomegalovirus infection appearing together in the patient with acquired immunodeficiency syndrome. So this is both viruses out there, but which one can make this type of lesion? This is definitely cytomegalovirus and not herpes simplex. Case 2, the same thing you see here. This form, if you see this form, it comes to your mind immediately that is Coxsackie virus. Case 3 will show you this type of lesions, which also caused by Coxsackie virus infection. This is all about our. This is two lecture compressed together, and there is no any more lecture for you. Just to give you overview about viral infection of oral cavity.